Dannemiller presents Emerging and Controversial Topics in Anesthesia.
Looking at per FTE measurements is an optical illusion. Really, you need to look at per anesthetizing site. What am I doing for every site I got to cover? And then I'll figure out how to cover it. Do that. And when you do it, you find...
Importantly, it has no activity at the GABA receptor, which is kind of the main receptor that is altered when you look at the bulk of our other anesthetic drugs. So the sympathomimetic
Can look like. I think those pieces give you so much information because you pull the drapes off and all of a sudden they have a rash all over them. Or I had a case not that long ago where we pulled the drapes off and she had like JVD through.
They shouldn't go to ambulatory surgery. They either need to get those conditions optimized and get their surgery later, or they need to, if surgery can't be delayed, they should go to a higher level of care. So then with
stroke therapy, what's the next step? So endovascular thrombectomy works. We can use GA or conscious sedation as without concern about injuring the patient from anesthetic toxicity or anything.
Found that deeper anesthetics are associated with an increased risk of delirium. And the thinking behind this is that these patients may have increased periods of burst suppression while they're under anesthesia. And
anterior dura and PLL, posterior longitudinal ligament, vertebral body is here. And this is transverse process. You see? Here. So, these methods we use.
I put on -20 suction, low suction until the lung is well collapsed. Pressure control ventilation, I think most people use pressure control ventilation. If you use volume control ventilation and you've got a blocker in there, if the patient gets light and coughs, then air.
Furthermore, they did exploratory analyses at multiple levels here. And the biggest things to look at are our confidence intervals right here. When you have a significant confidence interval, look at this. You're talking about appropriate reversal, inappropriate reversal. Once again, more postoperative respiratory complications.
Please visit us at www.dannemiller.com.